Jeremy, we're coming into winter, which is the time of year when lots of people get the flu. So what's your key message for the public about influenza?
Winter's now with us, and winter's a time we get influenza outbreaks. Every year we get an influenza season, and that means we get something between 10 and 20% of the community infected with flu. And the symptoms of flu can vary from being relatively mild to more severe, and tend to include a fever, sore throat, cough, runny nose, blocked nose, and in some people they can get complications. And the people at risk of complications tend to be the elderly and frail, people with underlying medical conditions, particularly those who need ongoing treatment by a doctor because of heart disease or lung disease or metabolic diseases like diabetes and so on. So they're the people we're really concerned about, who are at risk of getting complications, needing hospitalisation and even dying. So it's important to do all we can to prevent influenza.
Can you tell us some more about the flu vaccine?
Yeah, look, the best thing you can do to prevent influenza is to get a flu shot, a vaccine from your GP. And that's free for people with who are elderly or with underlying medical conditions. The other people at risk are pregnant women and Aboriginal people, particularly with underlying medical conditions. And so vaccination for those groups is a really important way of reducing your risk of getting influenza and its complications.
And if someone is unlucky enough to get the flu, what should they do to protect themselves and protect other people?
Yeah, look, if you get the flu, it's important to look after yourself and look after other people. So look after yourself by staying home and resting up, and that will help you get better quicker, but also it helps prevent spreading it to other people. So many people want to go to work and sort of do the best for your job, but in fact that's a bit of a false economy, because if you go on the train or the bus and go into work, you run the risk of infecting other people in your vicinity, because the flu is spread by coughing or sneezing or on your hands, and people who are around you within 1 or 2 metres can actually get infected when you cough or sneeze. So stay at home if you've got the symptoms of the flu, see a doctor if you need to, but what you need to do is basically rest up. If you're in one of those groups at risk of complications, such as the elderly, people with underlying medical conditions, or pregnant women, keep in touch with your doctor just to check that you don't need any treatment specifically for the flu. It's important, even if you don't have the flu, but if you're coughing or sneezing, make sure that you cover your cough and your sneeze with a tissue ideally, and then throw the tissue in a bin and wash your hands with soap and running water or an alcohol-based hand rub, because one of the ways that the flu is spread is not only through coughing or sneezing, but on your hands. And if you cough in your hand and then shake someone else's hand, they can then transfer the bugs into their eye or their mouth and then get flu themselves. So 3 things you need to do is stay at home if you're sick with the influenza, make sure you cover your coughs and sneezes with a tissue and throw the tissue away, and wash your hands after coughing or sneezing and regularly throughout the day to minimise your chance that you'll spread the flu to other people or pick up the flu on your hands and give it to yourself.